Welcome back, everyone, for another deep dive. Today, we're tackling a topic that's, well, it's about as high-tech as it gets in the world of medicine, AI, and medical coding. Now, you might be thinking, medical coding, that doesn't sound very exciting, but trust me, there's a whole lot more to it than meets the eye.
It's true. It's actually fascinating once you start to peel back the layers.
Exactly. And to help us do that, I've got an expert joining us who knows this stuff inside and out. Welcome to the deep dive.
Glad to be here.
So before we get to the AI part, let's start with the basics. For those of us who, well, let's just say we haven't spent our weekends memorizing medical billing codes.
Yeah, I don't blame you.
What exactly is ICD coding and why should we care?
Okay, so imagine a world where every doctor had their own way of describing diseases and treatments. It would be total chaos.
Right. Like trying to speak a dozen languages at once.
Exactly. So ICD, that stands for International Classification of Diseases, it's this really detailed system used globally to classify, well, basically every health problem you can think of.
Oh, wow. So every condition, every procedure, it all gets its own special code.
Yep. And these codes, they aren't just for, like, medical records. They're used to track disease outbreaks all over the world, to analyze how well different treatments are working, and yes, even to figure out how hospitals get paid for their services.
So it's like a backbone of all healthcare data.
Exactly. It's how we make sense of this huge, complex system.
Okay, so it's not just about paperwork. It's about seeing the big picture of global health. That makes a lot more sense now.
Right, but here's the thing. ICD coding, it's complicated. We're talking thousands of codes, and they're always changing. You need special training just to wade through all the paperwork and figure out the right ones.
Okay, so that's where AI comes in, right? To
Yeah.
make it all faster and more efficient.
You got it. Researchers are now developing some seriously smart algorithms, powered by things you might have heard of natural language processing or NLP. Plus, tools like RNNs, CNNs, even transformers.
Whoa, those sound intense.
They are, but think of it like this. You know how your phone can predict what you're going to type?
Yeah, it's kind of creepy how good it is.
That's basically the same technology at work here. It can analyze medical records just like your phone analyzes your texts.
So instead of some poor soul stuck reading files all day, the AI could potentially whiz through them in minutes.
Exactly, and that's just the beginning. But, and this is where things get really interesting,
You know I live for the buts. What's the catch?
well, there's this brand new research paper out of Tongji University in Shanghai. It's so new, it hasn't even been officially reviewed yet. And it highlights a fascinating little wrinkle in the AI world.
Ooh, we're on the cutting edge. Tell me more.
So it turns out that even the smartest AI, well, it can pick up some, let's say, interesting habits from the data it learns on.
Okay, so like, is this the AI deciding everyone over 60 needs a heart scan just because they're older?
You got it. That's a perfect example of what we call demographic bias, basically, when the AI jumps to conclusions based on big picture trends instead of looking at each patient individually.
So just because something's common in a certain age group doesn't automatically mean it's the culprit, right?
Exactly. In fact, the researchers actually use that as an example in the paper, atrial fibrillation, the heart rhythm thing.
Yeah, I've heard it.
It's way more common in older folks, but that doesn't mean every elderly patient with a bit of a flutter has it, right?
Right. So the AI could end up overdiagnosing some conditions just because of a number on a chart. It's kind of scary. But this new research, they found something even weirder about bias, right?
This is where it gets really cool, actually. They call it expert bias. Think about it. Even the best doctors, they have their specialties, right?
Oh, totally. Like you wouldn't go to a foot doctor for a brain scan. That's just common sense.
Exactly. But that specialized training, while obviously important, can also create blind spots. Like a hand surgeon. They might be amazing at spotting carpal tunnel, but miss something neurological that a brain specialist would catch in a heartbeat.
Because they're each trained to look for different things.
Precisely. Now, picture training an AI on a mountain of medical records, some from general doctors, some from heart specialists, cancer specialists. You see where I'm going with this?
Oh, I think so. The AI starts mimicking those same biases, even though no one's telling it to.
Exactly. It's not just what's in the data, it's who put it there in the first place.
Whoa, that is wild. So is there any way to like unteach that bias?
That's what's so exciting about this paper. They've actually come up with this new method called DECI, which stands for Mitigate Demographic and Expert Biases in ICD Coding through Causal Inference. Catchy, right?
DECI sounds like some kind of super smart AI that's here to fix all the other AIs.
Well, not quite, but it's a huge step forward. See, DCI uses this three-pronged approach, analyzing patient data through three different I guess you could say, lenses.
Ooh, three lenses. Tell me more.
So one lens is all about general medical knowledge. Another lens zeroes in on those demographic factors we talked about. But the third lens, and this is the really clever part, it actually analyzes the potential influence of different specialist viewpoints.
So it's like DCI is cross-referencing not just with textbooks, but with like a whole team of AI specialists.
That's a great way to put it. By comparing and contrasting these three pathways, DECI starts to figure out which factors are truly important for the diagnosis and which ones might just be bias creeping in.
So filtering out the noise to get to the good stuff, did it actually work?
That's the best part in their tests. DECI consistently beat out the existing AI models, sometimes by a whole lot. They saw a reduction in wrong diagnoses by up to 15%, which is huge.
15%? That's incredible. So does that mean we've solved AI bias in healthcare?
It's a fantastic start, but the researchers are very clear that DCI isn't perfect, at least not yet.
Always a catch. What are the downsides?
Well, for one, DTI needs a lot of computing power, way more than the current models. It might be tough to implement in, say, a small clinic with a limited budget.
So effective, but a bit of a resource hog. Gotcha.
Exactly. And it's not exactly plug and play. Each AI model needs its own special DECI setup. It's not one size fits all just yet.
Makes sense. But still, it feels like this research opens up so many possibilities. This is about more than just ICD codes, right? This is about the whole future of AI in medicine, isn't it? This is so much bigger than just getting codes right. This is about using AI to actually make people healthier.
It really is. Imagine AI that can analyze complex medical images to spot things like cancer early on when it's easiest to treat.
Okay, wow. So much better than just catching it late.
Or AI that can create personalized treatment plans based on a patient's unique genes and lifestyle.
That's amazing, like having a team of super doctors working around the clock.
And it's not just about treatment. AI could change the game for preventative care. Imagine AI analyzing your wearable sensor data, your diet, even your sleep patterns.
Okay, now that you mention it, my smartwatch has been giving me some serious side-eye about my sleep lately.
It's already starting. But seriously, this technology could give people more control over their own health than ever before.
It's like having a personal health advisor 24/7, but with all these advancements, we have to ask.
What could possibly go wrong?
Exactly. What are the ethical things we need to think about as we go further into this AI-driven healthcare?
That's the big question, isn't it? One major concern is data privacy. These AI systems need tons of data, but that data has to be handled responsibly, always putting patients' rights first.
We're talking about people's medical histories, their genetic information. That's a big deal.
Absolutely.
Yeah.
And we need to make sure these AI systems are built from the ground up with patient privacy and data security as top priorities.
So it's not just about cool algorithms, it's about building trust.
Exactly. Patients need to understand how these AI systems are being used, what data is being collected, and how it's being protected.
It's about making sure patients feel empowered, not overwhelmed or left in the dark.
Precisely. And that brings us to another crucial point, human oversight. These AI systems are amazing tools, but they should be helping healthcare professionals, not replacing them.
Because at the end of the day, healthcare is about humans caring for humans.
Exactly. We need that human touch, that empathy, that ability to connect with patients on a personal level to make sure this technology is truly benefiting everyone.
So as we stand here on the edge of this exciting new world of AI-driven healthcare, what's the one thing you really want our listeners to remember?
Be informed, be engaged, and be your own health advocate. This technology can change healthcare for the better, but it's up to all of us to make sure it's used responsibly, ethically, and fairly.
That's a great takeaway. It's been fantastic exploring this with you today.
It's been a pleasure.
And to all our listeners, thank you for joining us on this deep dive into the future of healthcare. We hope you found it as fascinating as we did. Until next time, stay curious and keep those questions coming.